Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower left eight and its relationship to the inferior alveolar nerve. Now, on the panoramic view, you can see that the lower left eight is impacted horizontally, vertically. My apologies, is impacted vertically with half of the tooth under the ramus, and we've got the inferior alveolar nerve in complete close approximation to the wisdom tooth apex. Now the transaxial view, which is basically the proximal view, this is the mesial aspect of the tooth. Along with the mesial aspect, you also have to see that the tooth is very closely associated with the distal root of the 7. Now moving towards the distal part, you can see that the inferior alveolar nerve is in fact buccally placed to the wisdom tooth on the lower left side. So this is the inferior alveolar nerve and this is the wisdom tooth. So we've got approximately 1.5 millimeters of space between the nerve and the tooth. As you move more distally, the nerve moves a little superficially but also moves away from the tooth. So this tooth at maximum point is approximately 1 millimeter away from the nerve, and this is the minimum distance between the two roots. So you can very clearly see between the roots and the inferior alveolar nerve. So very clearly you can see that this tooth is placed lingually. It's very closely fused to the lingual cortical plate. As you can see, there's no visible PDL space between the nerve, between the tooth and the lingual cortical plate. So if there are any further questions regarding this case, please feel free to reach to our team. Thank you very much. This is the sagittal view. Here we explained how the lower left 8 and the lower left 7, their roots are very closely associated. We will not call them fused, but you can very clearly see there's absolutely no space between them. So this is going to be something that our doctor needs to be very well aware of. This is the coronal view. Again, the coronal view can help you explain that how this tooth is placed lingually. We've got this is within the ramus, and this is where it's very closely associated with the nerve, and the lingual cortical plate is fused with the lower left eight, as you can very clearly see on this view as well. Thank you very much.